when most people who come to the psychiatric clinic, they carry a lot of what you call as emotional baggage. Previously, when we see depression, we talk about the mood being low, but what we find nowadays is because of the turn of economy, jobs, finance, debts, which actually has been a huge problem, marital distress. They basically get depressive symptoms secondary to a primary stressor. So the trick is not only treating the depression, but you also got to treat the primary stressor. And there's only one way to treat that. No medication can actually overcome people's grief, overcome people's sadness due to marital disharmony. They've got to voice it out. They've got to voice it out. They've got to hear themselves talking and then come to a decisions. Even counselors don't make decisions for them. They only help clients make their own decisions. So in that sense, starting off there, it just goes to show how important is it to help or to encourage patients to voice out their opinion, voice out the grief and the problems that may be a primary onset which leads to a secondary depressive mood, or it could also be anxiety or any psychotic symptoms. So that's where I think the Befrienders actually come in. They come in as a non-threatening, anonymous group of people who basically just listen to your problem, don't judge you, don't give you or tell you what to do. But in a way, patients would realize later on that by talking to people, they're basically listening to themselves and they're talking out what they feel. And eventually, they come up with some solutions where the Befrienders, basically those are doing online, will help them out, sort of possibly guide them to certain ways that they can actually do better. Now, we've seen lots of patients who basically just need a hearing ear, and they don't find that because people shy away, people have no time to talk, but they eventually hear themselves, they hear their own problems, and they come up with a solution to the problem, and that basically reduces the mood. And it does help. It's also help people decide or re-decide on decisions, like for example suicide. I find that the rates are actually quite high, and when people actually talk out their troubles, they come to a solution and they find out that there are multiple other solutions to one problem, not just suicide. And that's where the talking therapy basically helps. Of late, there has been a swing when you look at cases of mental health problems. Early on, when you look at early WHO reports, they used to actually target the mid-20s, people in their 60s, because of getting into job, getting into relations, or leaving job and retiring. But we've been seeing a spike in the youngsters nowadays, especially as early as early teens up to adolescence. Now, there could be many reasons for that. The shift in economy, forcing people to get out early, go into a job well. Maybe one reason, people who are basically not matured getting into a job, people who are not matured getting into life and relationships. So you find lots of issues with regards to work-related issues, relationships per se, boyfriend, girlfriend. But most probably one of the highest reasons for young mental disordered people would be the introduction of drugs. Recreational drugs is very common, not only around the world, but not very far in Malaysia. You find that the youngsters, especially in the teens, nowadays go for drugs which are called stimulants. They help them in many ways. They sort of think that those drugs basically perk their energy, give them initiative to work. For students, it enables thinking, the attention process, the concentration, but they don't realize that it actually causes a lot of changes in the brain, a lot of permanent damages sometimes, which can lead to problems. And the common ones that we see around here is early onset of psychotic disorders, and early onset of mood disorders like bipolar. Depression is very common when they suddenly decrease the drugs and stop. The habit of injecting or using needles can bring about blood-borne viruses like hepatitis C, HIV, leading to AIDS, and many of them basically go into this kind of issue and they find it very difficult to stop. Now, the crime rates have also increased among the youngsters due to their involvement in with drugs and drug-related habits. By WHO definition, the term mental health is actually defined as a sense of well-being among humans in multiple areas of functioning. So we're not just talking about thinking and acting and mixing, socializing. Work also comes under there. How you spend your life and recreational time also comes. So it's basically a huge area, mental health. It encompasses mental well-being in terms of how one thinks, mental status, how one behaves, the behavior, and how one interacts, that means your speech and how you actually go along with others. So in terms of that, keeping to a good mental health is something very important. Now, many people don't realize it, how to actually keep to good mental health. That means giving yourself time to actually spend time with the family, spend time for yourself, and of course there must be dedicated time for work. Now, keeping away from things that would discourage a bad mental health is actually something very important. Things like drugs, illicit substances. Well, as the thing goes, there is no definite way to stop everything. But I think everything taken under control is basically one of the best things to do. So basically, if you're drinking or you're an occasional person who takes alcohol, keeping that level under control basically maintains good mental health.